Since 1990, we have spent millions of euros and tens of thousands of research hours to find scientific answers to life's most important and challenging questions. What makes us happy? What makes us healthy? How can we heal from physical and mental disease? How can we heal emotionally and sexually so we can be happy in our relationships? How can we develop our talents and be of value to the world? We have interviewed more than 15,000 people and asked more than 4,000 different questions. After 20 years of intensive research, we are beginning to find the answers we have been looking for so long. We have already presented these answers in 250 research papers and about 30 books. Now we bring it over to you. Holistic adolescent sexology. This article was published in 2005 in the British Medical Journal, BMJ, and I wrote it together with Professor Jo Merrick and Dr. Gideon Vardy. And we are addressing the problem that so many teenagers are coming to the doctor with sexual problems, and it's really difficult to help them. In Denmark, we have a sexual debut around 13 years, and several thousands of young girls, 11, 12 and 13, are getting contraceptives every year. So we are taking care of these girls so they're not getting pregnant. But there are a lot of problems related to sexuality before they come to the doctor, and after they're getting contraceptives, even more problems are introduced because there are also side effects of the drugs, like less sexual interest, etc. So very often we need to give young girls advices about sexuality. You can say it's like 1 in 3 of the teenage boys who have sexual problems, but 2 out of 3 of the teenage girls who have them. So you can hardly see a teenage girl in the clinic without discussing these things if there's an open dialogue. And what teenagers need is really to understand sexuality. Very often they haven't been able to talk with any adults about it. They haven't been able to discuss these things with parents, and they have their knowledge from very often from pornography and sources of a poor quality. So you might be the first serious adult that are addressing these problems with them. So it's of course very important what you're saying, and what you have to tell them is basically what sexuality is about, and what the differences are between the male and the female sexuality. And many physicians are not really conscious about these things themselves. They don't know themselves well enough to understand these things in their own life, and this makes it very, very difficult for them to give good advices to young people. I think the most important thing you have to say is that you have to accept yourself. You have to accept your feelings, your desires, your body. And if you are not accepting yourself, you have to work on it, because accept is not just coming by itself. Sometimes you have to work on accepting yourself. You have to give yourself permission to feel what you're feeling and react as you're reacting. And honesty is extremely important. And in this way, you can give young people tools to work on themselves and heal their own sexuality if they are troubled. You need to know, of course, that 1 in 7 of the girls in the population have been sexually abused in childhood. This is the number we find in all scientific studies in the Western world. And if there are severe sexual problems, most likely there has been some kind of neglect or abuse or difficulty around sexuality in the dynamic with the parents. So we can say that some serious therapy is actually needed here, but very often you will not know what to say or how to give this therapy, and there will be few experts in society that really can handle it. So it's pretty much up to you, even in spite of this situation, that you're not very good. So what you have to do is that you have to give the full acceptance of sexuality, and you need to teach self-exploration, teach how to work with emotional issues, basically, and you'll better understand these things in your own life if you are going to help young people, because they can immediately feel if you know what this is about or not. Maybe I should say that if you're totally without any understanding, then you should back out and ask them to go to somebody else. You should refer them, of course. But yeah, we wrote this paper because we felt that this was a really important issue for many young people, and in general we are not taking well care of that aspect of adolescence.